The Trendelenburg sign is a good assessment for someone that has gluteal tendinopathy and or hip osteoarthritis. So typically they'll kind of complain of lateral hip pain and or weakness. So in this case we're going to assess the client's left side. So what you will typically do is the best thing to probably do is stand either directly in front or directly behind, and then you can kind of monitor from that way. So what I will do is kind of be off to the side so that I'm not in the way, and I'll put both of my hands on his iliac crest. And so since we're going to assess his left side, is you want to just make sure that both iliac crests are level to start with. And then what you're going to do, assessing his left side, we'll have him raise his right leg up. And a negative test would be that both iliac crests would stay level. And typically you want to do this for over a 30-second time frame. So again, a negative test is that he stays level with both iliac crests, so therefore your hand would stay level. A positive test is what would happen is the right side would drop. So the contralateral side would drop, therefore your hands, and therefore his iliac crest would be unlevel. So again, one places the leg back down. To start with, is you put both hands on iliac crest. He raises his right leg to assess the left side. A positive response would be he would drop on the right side, indicating weakness on his left side and or hip osteoarthritis. A negative test, again, is both iliac crests stay level and the right side does not drop. A weakness would be the right side dropping. A biomechanical explanation of Trendelenburg sign is this. In this test, what we would be doing is assessing the client's left side, and so the only bone that's shown on this side. So in this case, the client would raise their right leg up, which is the right leg is not shown in this biomechanical model. What we're trying to assess for is the gluteus medius strength. So kind of like my thumb here, the gluteus medius would be running in that manner. Again, so Trendelenburg sign is an assessment of gluteus medius strength and or hip osteoarthritis. So the client that has a weak gluteus medius and or gluteal tendinopathy and or hip osteoarthritis, when they raise their right leg in this case, what will happen is the pelvic girdle on the contralateral right side would drop, indicating weakness and or pain in the left hip. So the weak gluteus medius would not hold the pelvic girdle, therefore the contralateral side would drop. The client with hip osteoarthritis may also have pain, and they may indicate pain with this test. So a positive response with this test is either contralateral dropping of the pelvic girdle as shown, and or hip weakness on the side being assessed, which is the left side on this test.